morning and welcome to As Goes Wisconsin. Calvin is on the board. Greg Bach with me in studio, and you. We always love to hear from you. You can call or text at 844-967-2789. It looks like the snow is coming back. The little bit of sunshine we had is gone. Our very own civic media meteorologist, Brittany Merlot, is going to be joining us at 11:20 to tell us what to expect.
I have a name for that segment with Brittany.
Oh, you do?
We can call it Whining About the Weather.
Oh, that's good.
I'm so funny. I got Calvin to laugh. Calvin laughed at one of my dumb jokes.
And then coming up at 11:33, if you are of a certain age, maybe you have relatives who are of a certain age who are enrolling in Medicare. Now is open enrollment time. Now is when you need to look out for scams.
Yes.
And they're out there. So Ingrid Kundinger is going to join us at 11:33. She is with Wisconsin Senior Medicare Patrol, and she will share with us warnings about what to look out for if you're signing up for Medicare, because that's something that a lot of people are going to do. And
Yep.
I'm going to do it too soon.
Really?
Well, in 2 years.
All right.
So anyway, right now, though, this has been all over the internet in the last couple of days, last couple of weeks, actually. Florida Governor Ron DeSantis, who is running for president, and his campaign is not doing particularly well.
No.
There's this rumor going on about Ron DeSantis that he has lifts in his cowboy boots to make him look taller. And I just don't care. Do you?
No, I don't. I think this is a stupid waste of time.
But it's been all over the web. He actually got asked about it on Monday.
Yeah.
About the rumors that he wears hidden lifts in his boots so he looks taller. And they have people, he was on Bill Maher's show not too long ago. There are boot makers who are analyzing his boots. And in order to accommodate lifts, then you have to have a larger size boot. And that's why the top of his boot is looser than it normally would be. Oh, yeah. That's what people are spending their time on.
What is this, CSI cowboy boots? I mean, my God, this is like, we have things to talk about here. We have important issues to talk about here. And this is not even remotely close. This is a waste of time.
But this seems to be the kind of stuff that grabs Americans' attention away from important things.
It's
like
a great distraction.
It is a great distraction, like poison in our water and
fecal floods.
That's going to be the ongoing theme of this program today. Do you care if Ron DeSantis wears lifts? 844-967-2789, 844-96-PARTY. You can call, you can text if you are watching us on a live stream on YouTube, Twitter, and Facebook. You can also leave a comment on the stream, and we will see that as well. There's just so much obsession about Ron DeSantis' height.
Calvin, do you care that Ron DeSantis wears lifts?
I'm going to be the odd man out. I'm not going to say I care, but I find it hilarious.
Okay, yeah. That's fair. It's very funny. Like, I always, I'm a tall gent, so I don't deal with this stuff.
Right.
But he says he's 5'11", so lifts, if he's wearing 2-inch, 3-inch, he's 5'8", 5'9", he's above the average. It's fine. But the thing is, here's where I will come to the defense of Ron DeSantis. You heard it here, folks, right here on Civic Media.
Okay.
Wear your lifts, Ron. If that's what you want to do, if that's what makes you feel comfortable and makes you feel good, then fine. There are a lot of people out there who do things. They get cosmetic procedures
all the time.
And if it makes you feel good, it makes you feel fine, and you're not hurting anyone. I mean, your policies are hurting a lot of people, but your lifts aren't. And if you're wearing them, and I'm being dead serious here, do it, my friend. Do it. I don't care about the topic, but I care about him feeling good about himself.
Oh, you're just as sincere as Dan Schaefer just was.
Even though he is a demon.
We want him to be a comfortable demon. 844-967-2789, 844-96-PARTY. Texter says, just check his mugshot if you want to know how tall he says he is. Well, I don't think Ron DeSantis has a mugshot.
He doesn't have a mugshot. He wasn't part of the Trumpian
no
hurrah.
Right. No.
He didn't surrender.
But we do obsess We're just so easily distracted
Yes.
as a species, I
Yeah.
think.
Well, I mean, honestly, when it comes down to it, him wearing lifts or not wearing lifts is bite size. It's adjustable. It's fun. You can bring it up. It's 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 what we're doing now. We're talking about it.
True.
We are talking about it. You can't get away from it. We decided to talk about this, but in the overarching theme of everything, yeah, it's because those are the easy.
The
Now,
easy things.
yeah, now we've talked about it. Go to his website, read the policies he has, do some more work, and figure out whether or not he's a guy that you want to win the primary.
He's got a long road ahead of him.
I mean,
he's got a really, really long road ahead of him.
Yesterday, someone said was it, or today? My God, time's a construct. He has like $5 million.
That's nothing.
That is nothing.
No.
You can't run for almost anything. You can't, like, local races cost more than that nowadays. I mean, I think he's the next big one to drop myself.
I'm surprised he hasn't dropped before now.
I think Nikki Haley is going to take over as the quote unquote front runner, but that's just number 2.
Right.
I guess Trump's the front runner, but like the next possible person. But yeah, I think Ron DeSantis is going to go back to Florida and cloth himself in the fiefdom that is Florida, because down there he's a god.
Does everyone love him down there?
Well, maybe not now. I mean, that's the thing. That's the thing about this process. When Mitt Romney ran for president in 2012, he picked Paul Ryan. Paul Ryan was a less. I mean, he was known in the wonk circle in Wisconsin, of course, but he really wasn't known on the national
True.
stage.
Right.
And the moment he stepped out on that national stage, it became very clear that not only could he not be vice president, he's not a good politician, and he had to answer for a lot. The fact that he would release budgets every year that even his own party would disagree with, and then within 2 years, gone. So I think that people were saying the closest thing to a red wave we had last year. Sorry, once again, time's a construct.
Yes.
Was the fact that Ron DeSantis won so handily in Florida. He won quick. Like, he won big. There's really nowhere to go but down when you have his policies, his charisma. I said that in quotes, folks. Everything about him, I feel like, is going to lead to his eventual, like, downfall. And I don't mean that in a legal way. I just mean, like, if he wins the next time, it's not going to be by a large margin, I think. And I think you're going to see people say, "Oh, Florida is attainable now," because when your governor runs for president and he loses, that's weakness.
That's true.
So
that's true. 844-967-2789, 844-96-party. Mark from the SAC is on the phone. Good morning, Mark. Thanks for joining us.
Yeah, Ron DeSantis is so damn unctuous that.
Good word.
And CJ, if you're listening, that means oily.
Oh, Mark, be nice.
It is just disgusting. And why I think the 4-inch heels, the lifts, if he's wearing them, I think he probably is just the other part of his falseness. I mean, the guy couldn't tell the truth if his life depended on it, because I think I saw some statistic popped up the other day when Ron DeSantis, we only had one COVID death here. And I don't know if it was in a day or whatever it was, but it was actually 49 deaths due to COVID. I mean, he underinflates the numbers of the people that have died in Florida, and that the consequences of that from the COVID disaster that we had, that it is just so dangerous. But it just increases the narrative that comes these days primarily from the right, that it's okay to tell a lie that in furtherance of your political aims, that and spread deliberate falsehoods if it improves your standing. And if it is like George Carlin, I just saw it the other day and heard it, that they want us to be ignorant. They do not want us to critically think about anything anymore.
Absolutely.
Yep.
They just bombard us with half truths and outright lies, and we don't know where to. People don't know where to go anymore.
Well, and you're absolutely right, Mark. And they certainly don't want us to know what the definition of unctuous is.
I've learned today.
Thank you so much for calling, Mark. Really appreciate it. Tom from McFarland, we have just a couple of minutes left. Tom, thank you for joining us. What do you want to say?
Hi, thanks for taking my call. I think a closer parallel to DeSantis, instead of like Ryan or Romney, would be Scott Walker. Like DeSantis, Scott Walker won big in Wisconsin, and he thought he could take that, those coattails of that victory into a presidential run. And everybody was saying, how he was that front runner and he was the new golden boy for the right. And then he crashed and burned. And in the very next governor election, he got crushed.
That's very good.
I don't think DeSantis can actually run for governor because I think he's term limited in Florida. But I'm not sure on that.
We'll double check on that, Tom.
DeSantis and Walker is much closer.
That's actually a very good point.
Really good point.
I can't believe I forgot that.
Thank you so much for calling. Appreciate it. And my favorite remembrance of Scott Walker is when he claimed that he had that little bald spot on the top of his head because he hit his head on a kitchen cabinet.
Yeah. Very correct. 2 consecutive 4-year terms is the most common term. Oh, no, that's just the. Yeah. Oh my God, Scott Walker. I can't believe I forgot Scott Walker. That was the best. I feel ashamed of myself. That was a way better comparison.
That's why we have listeners.
Yeah.
844-967-2789. All right, we're going to move on. Brittany Merlot, our civic media meteorologist, will be with us when we come back. We're going to talk a little bit weather and find out if your kids are going to be able to go trick-or-treating without their snowshoes later on tonight. Stay with us. This is As Goes Wisconsin. You're listening across the Civic Media Radio Network. Good morning. Welcome to As Goes Wisconsin. Jane Matnair in for Kristen Bry. She is on maternity leave, but she will be joining us tomorrow morning at 10:33. So I hope you will join us. Encourage you to watch the live stream on Twitter, Facebook, and YouTube if you want. Hopefully we'll get a little peek of little Frankie Lou tomorrow and see how she's doing. She was a little noisy last Wednesday, so we didn't get to see her. But that is tomorrow morning at 10:33. Right now, though, we're so excited to welcome her back. She is the meteorologist for the Civic Media Radio Network, Brittany Merlot. Good morning, Brittany.
How are you?
We're doing great, thank you. So, where are you?
Where am I? I'm in Wausau.
You're in Wausau. So, what's the snow situation in Wausau?
We've got about 2 inches of snowfall that's sticking to mainly the grass out here. So the roads aren't too bad. They're just a little wet. Everything seems to be melting on the roadways. But yeah, I would say the snow is quite scary for Halloween, right?
Well, we were talking about this yesterday. It always seems like Wisconsin, Midwestern kids always get ripped off on their Halloween costumes, especially if you wait until actual Halloween, because you have to put the parka over your ghost outfit.
I know. It's like, you don't want to conceal your costume when you've been waiting all year for this day.
Right.
But those winds are going to be vicious. It's not even going to be the snow later on this afternoon and evening. It's going to be mainly those winds. They're going to be gusting up to about 30 miles an hour out of the north. So it's going to take our temperatures. Yeah. It's going to take our temperatures and make them just bone chilling, basically.
So where are we right now?
At highs in the upper 30s.
Oh, okay. So highs only in the upper 30s today.
Yeah, that's it. And then you put the wind on top of that, it's feeling like the mid-20s out there. So if you're out trick-or-treating, you're going to want to dress for basically mid-20s to maybe upper teens. You want to layer those kids up, that's for sure. Put the parka underneath, costume over it, dress them like an animal. I don't know.
I'm putting the candy outside. They can take it themselves. I'm not answering. I'm not opening a door.
That's the lazy way of doing it, but you're still doing it.
Thank you, Jane.
Brittany Merlot is our guest. She is our meteorologist for the Civic Media Radio Network. Brittany, this snow that we've got today is part of a much larger system. Is that correct?
Oh, yeah, absolutely.
And that's all moving to the east.
All moving to the east. So by this afternoon, the low pressure system itself is going to be over Lake Michigan. And that's where I think when the winds really start to whip out of the north, where if you live by the lake, you're going to probably see some lake effect snowfall right around those trick-or-treat hours. So from about like 3 to 7, I'm thinking some of those lake effect snow bands are going to set up across Lake Michigan. So that'll be a thing. I mean, Lake Superior's already been whipping some pretty intense snow bands off of it. and towards Ashland. I think that's starting to move towards Ironwood now. But I mean, I was seeing reports of visibility down to just a quarter of a mile where they're looking at 1 inch of snow within an hour. And I've seen snow reports coming in from Spooner up north where they've already gotten over 6 inches of snowfall. So
6? Are
it is winter
you're
wonderland up there.
6 inches?
Yes, yeah, isn't that wild? Yeah, they're coming in at 6.9 inches.
That's basically 7, in my opinion.
And that is in Solon Springs, so a little bit further south than Spooner. Solon Springs. And it also looks like reports of 5 inches up towards Red Cliff, Bayfield area. So I don't think Lake Michigan towns are going to get anywhere near that. Maybe just another inch or two on top of about a half an inch is what I'm seeing right now to the Fox Valley. But it's just 91 snowstorms. Some people remember that Halloween up
I remember
north.
that
And they
one.
got pummeled.
Yep. I remember
Yeah.
that snowstorm. I remember there was a snowstorm May of 91 or 92. I remember waking up in the morning and telling my mom, there's snow on the ground. She's like, no, there isn't. Go back to bed. And when the next time she woke me up, she's like, you had the day off from school.
Because of snow in
'Cause
May.
Yep.
Well, this is not all that
Oh,
unusual,
that's awesome.
right? I mean, this isn't unusual that we get a little snow on Halloween, but I was looking ahead a little bit, Brittany, and aren't we going to be back into the 50s, at least down here in Waukesha in a couple of days?
Yeah, I think it's going to be in the 50s by upper 40s by Thursday. You'll hit some 50s by Friday, and you might even hang on to that by Saturday. It looks like some rain might be moving in to close the weekend out. But yeah, so some decent temperatures are going to come back. We always snap from cold to mild this time of year, and those winds get really, really strong too. The gales of November. Can you believe it's November tomorrow?
No.
I'll go to the bank. Thanks for reminding me.
Why do you go to the bank? Because it's the 1st of November.
Pay some bills.
Oh, okay.
And Brittany was here to remind me, and I appreciate Brittany Merlot.
Oh, did you hear, Brittany, before you joined us? Greg has a new name for our segment when you join us now.
Oh no, what do you got for me?
Whining about the weather with Brittany Merlot.
Yes.
I think it works.
That's perfect.
I think it works.
We'll get a graphic and everything.
Yes, we have to.
But
I like that one a lot. That was clever.
You also gave us good news when we had you on last week that it should be a milder winter overall.
Yeah, overall, we're looking at the El Nino pattern kind of setting us up a little bit milder temperatures, especially through the overnights. And then hopefully it'll keep more of the snowstorms away from us, where we won't get piles and piles of it. So a little less snow, a little milder temperatures for this winter, but we're still going to have a Wisconsin winter.
Absolutely. And we need it. we need a Wisconsin winter.
Yeah.
We do. What about as far as the rest of today? The lake effect snow, is that going to be the biggest concern? There were just so many accidents today, Brittany, all across the state. And I'm thinking because not all of it was because there was so much accumulation, but it was more the visibility issues.
Yeah, visibility. Those winds are just whipping. So I really just think the wind is going to become the problem. The scattered snow showers are going to continue for the next, I would say, until about 2 o'clock. We'll see them on and off till about 2 throughout the state. And they're really going to start to diminish. Most people aren't going to see any snowfall whatsoever for trick-or-treating tonight. But those winds are going to get vicious, gusting up to 25, 30 miles an hour. So it's just going to feel really crisp and cool. So just bundle up is my key thing. And of course, make sure you have some boots on in case, the grass is a little bit sloppy still from the snow. But anyhow, the winds off of the lake from about 3 to 7, I'm thinking, is where we're going to see some lake effect snow bands, where we could see more accumulating snow. Pretty much from Manitowoc down through Kenosha and into Waukegan in Illinois. And again, that'll just you'll see it moving south throughout the day or throughout the evening as those winds shift and the system takes off to the east. So it'll be gone by tomorrow. And like you said, we'll warm up, but it'll be a little chilly for us.
Little chilly. Hang on to those witches' hats because the winds are going to be are going to be kicking it up. Brittany Merlot, the meteorologist for the Civic Media Radio Network. Thank you so much for joining us, Brittany. Really appreciate it.
Thank you. Happy Halloween.
You too. Have a great day. Stay with us. We have the news coming up. When we come back, Medicare scams. How can you protect yourself and your loved ones? That is on the way. You're listening to As Goes Wisconsin on the Civic Media Radio Network. Good morning. morning. Welcome to As Goes Wisconsin. Jane Matnair in for Kristen Bry. Calvin on the board. Greg Bach with me in studio. And delighted to welcome to the program Ingrid Kundinger. She is with the Wisconsin Senior Medicare Patrol. And we're going to talk about how to protect yourself and your loved ones from Medicare scams, because it is open enrollment time, right, Ingrid?
That's right. Thank you so much for having me this morning. And yes,
Absolutely.
it is Medicare's open enrollment period. That's an opportunity every year for people who are on Medicare to review their current plans and make sure that they're still meeting their needs. And if perhaps they're not, this is an opportunity for people to make changes to their plans for the next year. So that time period is October 15th through December 7th. That is what's called the open enrollment period. That's when people can make changes, and then those changes would go into effect on January 1st of 2024.
Ingrid, tell me, what is Wisconsin Senior Medicare Patrol?
Wisconsin Senior Medicare Patrol is part of a national Senior Medicare Patrol program. We receive funding through the Administration for Community Living at the federal level. And the mission of our program across the country is to provide education and empowerment to Medicare beneficiaries and their advocates to help them protect themselves from Medicare-related fraud and scams. And then we also provide information about how they might detect if perhaps something isn't quite right with their Medicare account. And then we also provide a way that folks could report any concerns or issues that they might have to us, and then we can kind of help them from there. So we do all of those things in a number of different ways. We do a lot of presentations and community outreach events, and we also operate a toll-free helpline that folks can call to speak directly with us.
And what is that line?
That phone line is 888-818-2611, and that's answered by us here in Wisconsin. And you can share your concerns, your frustrations, and we will kind of help direct traffic and first and foremost make sure that your Medicare account is safe.
So at this time of year, when open enrollment is going on, and maybe I'm sitting with my mother or my grandmother, and some ad comes on the TV and it says, I have this great plan for you. You should call me today. And because I was on this TV show 25 years ago, you can trust me and call now. Should I be worried about that?
I would say yes, you should be maybe not worried, but very cautious. There are a lot of those commercials on television right now. Obviously, all of the plans are wanting to lure people to choose their plans over other plans. And while those advertisements are not necessarily fraudulent, they can be very misleading. Oftentimes, people think that when they call the Medicare helpline or the 800 number that's advertised during those commercials, that they're calling Medicare directly. And unfortunately, that's not the case. They are getting connected with some sort of insurance company, broker, third-party marketing organization, which oftentimes then turns into or can turn into some pretty high pressure sales tactics where people feel pressured to make decisions quickly, maybe without having the full information before making that decision. So we encourage people to just take a break from those things. And, oftentimes if it seems too good to be true, it probably is. But we also encourage people to either connect with us or to connect with their local aging and disability resource centers to get some unbiased information so that can kind of help you sift through. Because you know what? It's not easy. Heaven forbid that any of this stuff be easy to kind of sift through. And there's a lot of it. And, the implications of choosing one plan over another can be significant for a person come the new plan year. So it's really important to not feel pressured, to take the time to do your research and have, unbiased information to sift through as you're making those decisions.
And that's why that phone number that you provided is so important, because that's the number that you want to call, not the number attached to these ads that are running on television, which again is not necessarily, illegal,
Right.
but misleading.
Correct.
Ingrid Kundinger is our guest. She is with the Wisconsin Senior Medicare Patrol, and we're talking about ways to protect yourself from scams and maybe some deals that sound pretty great but aren't necessarily so fabulous. I'm going to be 64 next year, Ingrid, and so the year after that, I will be applying for Medicare. Can you take me through the process? What do I start with?
Sure, that's a great question. And there's lots of people every day that are continuing to age into the Medicare system. And like I said earlier, it's not super simple. So, start early, start getting information, connecting with, again, like I said, the Aging and Disability Resource Centers in all of the counties across the state of Wisconsin. They have a team of staff that are enrollment counselors, and they provide monthly or quarterly welcome to Medicare seminars that kind of walk you through all of the things step by step. I mean, there's a lot of decisions to make about whether you think that original Medicare directly from the government, parts A and part B are going to be what's best for you. Then if you choose that, is it something where you'd like to add a supplemental plan to that? Or would you like to privatize your Medicare healthcare coverage, meaning that you would choose a Medicare Advantage plan? And, those things are going to provide the same benefits as original Medicare, but sometimes those plans are able to offer additional benefits that Medicare isn't able to cover. And then there's also a prescription drug plan. And so there's just a lot. So we really encourage people to, like I said, start early, start to educate yourself about all of those choices now, so that when it gets closer to the time that you are eligible to enroll in Medicare, that you feel empowered and you have that information and know what's most important to you as it relates to your healthcare coverage going forward, to make sure that those needs are met. If there's a specific group of doctors that you want to continue to be able to see, then when you're choosing plans, it's going to be important for you to make sure that you ask those questions about those providers. And it'll be important to have a good handle on what prescription medications you're taking, because all of the Part D prescription drug plans can be a little bit different in terms of the formularies, which the formulary is kind of the encyclopedia of medications that each plan covers, and at what tier or how it's covered or what the copay structure looks like. So just a good reminder for folks to just kind of start thinking about those things. It's never too early to start because it can be overwhelming. The good news is you do have a bit of time when it's about time for you to enroll in Medicare. 65 for most people is the triggering age for that.
Right.
And you can apply for Medicare up to 3 months before your 65th birthday, the month of your 65th birthday, and then the 3 months after that. And it might seem kind of different, but you actually enroll in Medicare through the Social Security Administration. So sometimes people don't realize that as well. So while all of the healthcare and things are handled by Medicare, the initial enrollment of that takes place through the Social Security Administration.
Ingrid, what are the ramifications if I do not get Medicare Part B? What does that mean?
So if you do not get Medicare Part B, that means that you potentially would pay a penalty from the time that you should have had a Part B plan for until you would maybe change your mind. Medicare does unfortunately penalize folks for not signing up for that, and in some cases prescription drug plans as well. So again, it's important if you're still working or there's employer coverage that you're going to be sifting through along with Medicare. Again, really important to talk to someone who can kind of help steer you in the right direction. Maybe that's an HR person at your employer to help you understand what that looks like and how that's going to be happening. And if Medicare is the first payer and your employer is the second payer, just good to know all of that stuff ahead of time so that you don't miss enrolling in that Part B coverage and then realize that there's going to be a penalty that you must pay going forward.
Well, and from what I understand, and I might have this completely wrong, but if you don't have Part B and say you are hospitalized, you've had a heart attack or whatever, there are things that will not be covered because you didn't carry Part B, like ambulance rides and things like that.
Absolutely. Part B coverage is typically things that happen to you in the doctor's office or the clinic. Part A is more the hospital insurance. And then Part B is kind of all of those other things, ambulance services, some forms of durable medical equipment, and other ordered from your physician or healthcare provider, medical supplies that you need for certain diagnoses. Those things would be covered through the Medicare Part B coverage. So yes, if you didn't sign up for that, you will likely have to pay for all of those
Right.
things out of pocket versus having that Part B coverage and Medicare's assistance in covering some of those expenses.
And in some instances, I mean, that can be thousands and thousands of dollars. From what I understand, ambulance rides don't come cheap.
That is absolutely correct. It seems like a fancy way of transportation, and obviously it's necessary, but it's also very expensive. So, as are some of the, doctor's appointments or lab tests or other things that happen in a doctor's office. So, yep, very important to make sure that you have all of your bases covered and you understand if you make the decision not to have that, that you will have some out-of-pocket expenses going forward with your healthcare.
Ingrid, this may be an impossible question to answer, but I'm going to throw it at you anyway. Can you give me a ballpark estimate of my monthly cost if I sign up for Medicare and Part B and Part D and Part Q? I mean, is there a ballpark around what I should be paying monthly?
That's going to depend on a lot of the things that you choose. And I can get this information. I'm sorry, I don't have it available now, but there are, if people go to the medicare.gov, not .com, .gov website, that does outline the costs for Medicare, just traditional Medicare for the year. So there's a premium for the Part A insurance. Oftentimes that is covered from people's work history, so there's not an expense with that. I don't remember what the Part B premium, monthly premium is, and then the Part D. And then it kind of depends on what plan you choose. If you
Sure.
choose a Medicare Advantage plan, depending on what level or which plan, if it has a Part D prescription plan, drug plan, if it doesn't. So starting with the information on the Medicare website and then kind of building that from there. But again, those are great questions to ask too, and to start understanding what those costs are going to be as you're planning for retirement. You do need to think about the costs that will be incurred as a result of your health care.
Absolutely. Well, again, give us that phone number one more time, and then we will have all of this information in our show notes once the podcasts get posted after the show is over. So, Ingrid, one more time with that 800 number.
Sure, that's our Senior Medicare Patrol program here in Wisconsin, and the toll-free number is 888-818-2611.
And then you said the website was medicare.gov.
Yes, that's the Medicare website is medicare.gov. If you do a .com, it's an insurance site and it'll get
Sure.
you things that you are not interested in. So just make sure that it's the .gov from the government.
This is such valuable information. It really is for people like me who are approaching that age, for people whose parents are at that age. And it's a lot to consider. It's a lot to look at, but it's really critically important. So thank you so much for joining us. Ingrid Kundinger is with the Wisconsin Senior Medicare Patrol. Really appreciate all your time, Ingrid. Thank you so very much.
Absolutely. Thank you.
Stay with us. We will be right back after the break. This is As Goes Wisconsin on the Civic Media Radio Network. Good morning. Welcome back to As Goes Wisconsin. Jane Matt Mayer in for Kristen Bride. Calvin on the board. Greg Bach with me in studio. You can always check in. You can call and or text at 844-967-2789. That is 844-96-PARTY. Also, if you're watching on the live stream on YouTube, Facebook, and Twitter, you can also leave a comment there. And we have Tom on the line from Grafton. We were just talking about signing up for Medicare and what that all means and looking out for scams and stuff. Good morning, Tom. What do you want to say?
Well, I wanted to say that I'm so glad that you had this on the subject, and I wish you'd do it actually more, maybe once a week or so for 15 minutes, or because it's one of the most confusing things that are out there for healthcare, and there's a whole industry that's designed to actually steal money from you and take you away from the government program to private ones where you don't get as much and you pay more. So I'm just glad that you have this on, and I wish you'd have it on more. I think there's a great need for it.
Well, we're delighted to have her on, and I don't disagree with you that this doesn't get talked about enough. And I think it's real easy when people see Medicare Advantage and I'm so and so from Hawaii 5-0, and you should trust me and sign up for this. And as Ingrid said too, Tom, if it sounds too good to be true, it probably is.
A lot of scams.
Yeah, they're never going to call it Medicare scam. It's called Medicare Advantage without really explaining what that means.
And it's just a hustle to take it from the common people, and to deceive them like so much stuff.
Are you on Medicare, Tom?
No, I'm too young for that, but I'm interested in learning about it, so I don't have to rip off as I do cross over to that,
Even with Ingrid describing it, it really does sound confusing.
Yeah.
But
agreed.
the fact that we can call directly to people here in Wisconsin instead of some 800 number that's going to send you to who knows where, or they're going to try and sell you something. That's a great advantage. And again, we will have all of that stuff posted.
It's a Medicare Advantage.
It's a oh,
yeah! I'm on fire today.
Thank you so much for calling, Tom. Really appreciate it. Sharky from Racine is on the line. Good morning, Sharky. How you doing?
Good morning, and thank you for your service, all of you folks. I'm so happy you're out there.
Well, thank you.
I have a friend. I have a friend that's at 64 mark, and I know that they're taking Obamacare right now. And I'm wondering, once Obamacare, does it disappear? Then you have to find this private insurance, basically, because I'm under the impression that Medicare basically is 50-50 if it's half private, half government as far as the payments to the patients. So the question was Obamacare, where it sits in there somewhere, or do they continue on with Obamacare at the same rates they had before?
Well, I'm assuming that if they want to get supplemental insurance, if they take Medicare, and I'm not an expert, but it just seems like the common way to do it. You would take Medicare, and then if you wanted to supplement it with a private insurance, you could still go through the exchange and get private health care through the public websites.
But that would be another question, Sharky, to take to that number that Ingrid gave us, and ask someone who knows, because Greg and I unfortunately are not experts on this. And
I'll give you the number again. It's 888-818-2611. That's the phone number for Senior
Patrol.
Medicare Patrol.
Yep, here in Wisconsin. So, yeah, any questions you have, I would take it to them. Thanks a lot, Sharky, and thank you so much for listening. We really, really appreciate it. It is critically important information, and
it's stuff I think about, and I'm 20 years away from it.
Right?
Yeah.
But I feel like we should have Medicare sign up babysitters.
I mean, honestly, that is a whole other conversation we could talk about for an hour. But the idea of not just financial education, but just all these, like before you get a student loan, you should have to sit down with a student loan counselor and say, here's what's going to happen.
And here's
X,
what this means.
Y, and Z.
Yeah.
You want to do Medicare? All right, we're going to have a class. We're going to run you through it. This is, we are a real group. We're not going to take your money. It's free. That kind of thing. We just want to be able to get educated on these things that can be, like we were talking about earlier, taxes.
Yeah.
Like all those comments were valid on the convoluted nature of filing taxes, especially if you're a small business owner, if you're itemizing.
Right.
There should be more education out there.
Well, and as Ingrid said too, they put on seminars from the Wisconsin Senior Medicare Patrol. They put on seminars and have educational opportunities so people can get a little more up to speed on it. So take advantage of it, and make sure to again, we will have the show notes posted within an hour after the show is over. So if you want that number and all the other links and everything to all the stuff we talked about on today's show, you can find it at civicmedia.us. Okay, tomorrow morning, Kristen Bright,
who?
Mama will be joining us
I don't know who this person is. What are you
at
talking?
10. The person who
This
started
is new.
Asgo's, Wisconsin.
Who's that?
The
I don't know
name
what
of
you're
the
talking
show,
about.
She's the one who started the whole thing. She will be here tomorrow morning at 10:33, hopefully along with little Francis. We'll see how the baby is doing. And then Greg and I are going to kick some things around
Oh, we are we?
on a Wednesday.
Yes, we are.
Yes, we
Kick
are.
it. Da,
Kick it.
da, da, da. I'm a hip person. I know the music.
Thank you so much to all of our guests today. Dan Schaefer from the recombobulation area, civic media meteorologist Brittany Merlot, and again, Ingrid Kundinger from the Wisconsin Senior Medicare Patrol. Just really important information. And I hope we all learn from it and take advantage of it.
I did. I should talk to my mom. Oh, she's got it taken care of.
You spread it? You sure?
Yeah, my mom's been on Medicare for nearly 15 years.
Okay,
at this
then
point.
she's probably
Yeah.
covered. All right,
Yeah.
don't go away. We have Todd Aller Show coming up right after the noon news. Have a wonderful day. Happy Halloween. Thank you so much for calling. Thank you for texting. Above all, thank you for listening. We will see you tomorrow morning right here on the Civic Media Radio Network.